All right. Well, thank you all for coming to what is the first of 4 information sessions regarding the audit of Colorado safety and risk assessment tools. Again, this audit was done in compliance with House Bill 241046. And one of our big priorities in releasing this audit on behalf of the CPO was to make sure we had lots of access points to the team who completed the audit. We're going to go through a little bit of the history and the background. Our entire ICF team, who you see here on our screen, will be here to talk about methodology, about how they approach multiple aspects of the programs, how they came to their findings and their recommendations. They're going to work to address the questions that you have. We do ask just so we can kind of keep everything moving along because there's a lot of information to share. I know everyone here knows how long the report was. If you put your questions in the chat, Yumiko and Anne are going to be watching that really closely so that we can monitor those questions, make sure that we get them answered. And if there's follow-up needed, we'll be encouraging folks to come off mute and just make sure that we're getting all of your questions answered and we understand what information would be helpful for you as we get into that. So before I pick up the PowerPoint, anything from our ICF team or Stephanie before we begin? Okay.
No, nothing from me. Thanks for joining.
Absolutely. So I am going to spotlight our team so that we all know who is talking quickly. Maddie. Anna. Hi, Gretchen.
I think you'll have a bunch of people joining. Subpack was running over, so just warning you, you might have a bunch more people join. So hi, everyone.
That's really helpful, Gretchen. Thank you. All right, so I'm going to go ahead and get our deck started. Okay, so again, as I said, thank you all for being here. We're really excited to connect all of you with the ICF team who completed the audit. We're going to kick off with this presentation, which will also be posted to the CPO's website, along with the recording of this call. So if you have further questions or you want to come back and revisit anything that we discuss, all of that material will be available to everyone. So a little bit of background on the project, as many of you know, this project really originated from the 2023 Child Welfare Interim Study Committee. The CPO was one of several community partners to come and present to legislators during those hearings in that summer period. And one of the issues that the CPO presented to that committee was inconsistencies in how our analysts were seeing the tools, the safety and risk assessment tools being used by caseworkers across the state. For several years, our lead analysts, Amanda Pennington and Claire Hooker, had noticed inconsistencies, inconsistent application, inconsistent results, inconsistent sharing of information in that tool. And that was something that we felt had hit that systemic level and required some additional study. We presented that issue to the interim committee, and it was one of the issues that they actually picked up and carried forward into legislation, which ended up being House Bill 241046. Following passage of that bill, our office, the Office of the Colorado Child Protection Ombudsman, was required to procure with a third-party entity to conduct the audit, which was detailed in that bill. So here you're going to see that there were 9 directives the bill directed ICF to consider when conducting this audit. So there were things and points that they had to look at. The bill actually articulates which tool was applied here. And so these were the guardrails for the audit, and they're going to be the guardrails for our presentation here. And it explains why they focused on the areas of the tool usage that they did. Also really want to go through that CPO went through a very in-depth procurement process. We wanted to be very mindful of bringing in our community partners when we were searching for who best to fulfill this duty outlined in the statute. So the CPO team assembled an evaluation team, which did include representation from the Division of Child Welfare, County Departments of Human Services, the Office of the Child Representative, Office of Respondent Parents Council, as well as a parent with lived experience in the Colorado Child Protection System. And this was really to make sure that we were considering how this audit was going to be conducted, not just the directives that were included, but was this the best entity to really look at that 360 consideration that we knew that the General Assembly was looking for, and using those standards and based on that involvement from all of our community partners, ICF was selected as a third-party contractor to conduct that audit. And that is the team who we have on here today. And that is the team who I'm going to pass this presentation over to. So I will let Anne take it away.
Great. Thank you, Jordan. Appreciate that. So certainly we set out in the beginning to set some really clear roles between between CPO and between ICF. So certainly the Office of the Colorado Child Protection Ombudsman provided that overall oversight to be sure that ICF researched and audited the critical elements of the statute. CPO partnered with Yumiko Doherty of Ignite the Change, LLC, to serve as project manager and a liaison between ICF and the state and counties, ensuring that the ICF team understood the context of Colorado's work and were able to access state, county, and stakeholder team members necessary to inform and complete the audit. ICF's role centered on designing and refining methods for research, data collection, engaging varied stakeholders to hear their experience, and collecting and analyzing data to compile as reflected in the findings in the final report that met each of the directives of the audit. Next slide, please. Our overall audit approach was to address all of the requirements outlined in House Bill 24-1046. The ICF team developed a multi-level mixed methods approach designed to capture individual, family, and system-level perspectives. This integrated design enabled the team to corroborate findings from multiple data sources, mitigating single method bias, and enhancing the rigor of the audit and the reliability of the results overall. This approach emphasized stakeholder engagement throughout the process. It was iterative, stepwise data collection that was conducted in collaboration with the CPO liaison, Yumiko, who provided the essential coordination and connection to resources throughout our process. The ICF team included subject matter experts in child welfare practice and safety assessments, those with lived experience, research, evaluation, and program audits. We'll review the team's methodology, data sources, and review the findings per directive throughout our time together today.
Anne, do you want to introduce the team?
Yes, absolutely. Now with that set up. So I am Anne Graham of ICF. I served as the project manager, child welfare practice, and safety expert. Donna, would you like to share?
Sure. I'm Donna Kleigold. I'm a research evaluator on the project and worked with Anna as co-researchers, and happy to be here with you.
Hey, y'all.
Anna?
Yes, as Donna mentioned, I was another researcher and evaluator on the project involved in some of the data collection and analysis, and I'll pass it over to Maddie.
Thanks, everyone. I'm Maddie Langen, also with the ICF team, and primarily I worked with our Great Lived Experience work group.
Great. Thank you all. Appreciate that. Our work together throughout the time really began in earnest in March of 2025, where we began our engagement with CPO and Yumiko of Ignite the Change, really designing that work. So our activities kicked off and we started moving, as you can see throughout the months reflected here. We engaged stakeholders throughout the process to allow for the most robust process possible, all the way through to today of what you're seeing today. Each phase of our audit built upon the efforts and findings of the previous months. For example, the research on best practice and discussions with the work group participants informed the development of rubrics for evaluating Colorado's assessment tools, policies, and cases. It also informed the development of the survey, focus groups, and interview questions. We're now going to dive more into our process around engaging stakeholders. So thanks so much.
Thanks, Anne. I'm going to walk through a key part of our engagement strategy, which was collaborating with those who knew the system and tool best. This ensured that our findings were not only technically sound, but also grounded in the realities of those impacted. We had two ongoing stakeholder groups, the Lived Experience Work Group, and we also had the Workforce Work Group. These work groups met monthly, providing continuous feedback and guidance on the work. We also engaged other stakeholders in more targeted interviews and discussions, and we'll dive into that a little later. The work groups and their contributions ultimately ensured we had the local context and that shared experience was a part of the data collection process. But before I expand on those contributions, I'm going to walk us through a recruitment process and who was actually in these groups. So to ensure we included the right voices, we used a structured selection process for the two work groups. We began by sending formal invitations in an interest form to a diverse group of potential participants. You can see those groups to the right of the slide here. So for our workforce work group, again, try saying that 10 times fast, we sent out our invites to the 64 county human services directors. And for our lived experience work group, we sent them to the following organizations listed there, with some more targeted recruitment for areas that were lacking representation. When reviewing the responses, we considered several factors to ensure that there was meaningful representation. Some of these considerations were type of lived experience, so including current or former foster youth, parents with lived experience, and kinship providers. For workforce experience, we prioritized folks who are on the front lines using the assessment, so that was caseworkers and supervisors. Familiarity with the tools, race and ethnicity to reflect the diversity of the community served, regional representation, and of course, availability to participate in these meetings. Lived experts were also compensated for their time and contributions, recognizing the value that they brought. And on the next slide, we can dive into the demographics of these groups. Thank you. For the lived experience work group, we had individuals across 4 different regions, each bringing unique perspectives based on their lived experience. This included parents with lived experience primarily and 2 former foster youth. And for the workforce work group, we had frontline staff across 5 different regions, representing 7 counties, and we had 5 caseworkers and 3 supervisors. Now, to expand on the contributions that I mentioned earlier, these work groups served as a primary source of information and ensured we had the local and lived experience lens on this evaluation. We used the work group meetings to gather information on each area of analytic focus in the legislation. Through structured discussion guides in the work groups, we explored topics like barriers to completing the assessment in real time, the impacts of race and ethnicity on practice and decision making, geographic variability in caseworker practice across regions, and the impact this had on lived experience perspective. Also, how assessments are being used for domestic violence and intimate partner violence, perception of the tools, and how assessments are used to support decision making. These work groups allowed us to capture firsthand insights from those closest to the work and the families being served. And as we all know, these voices are essential for driving meaningful, lasting change. I'm now going to kick it over to Anna to walk us through the review of documents and best practices that I briefly touched on.
Okay, thank you so much, Maddie. So early on in the project, along with kicking off both of those work groups, we were conducting a foundational literature review to gain an understanding of general best practices associated with safety and risk assessments in the child welfare context nationally. So to do this, we used a systematic process which started, is depicted on the slide here, starting with identifying search terms and inclusion criteria, screening titles and abstracts, full texts, and then synthesizing results from 30 articles that were selected as the most relevant. Once we did that at the beginning of the project, we didn't just stop and say, okay, we're good. We continued the process iteratively throughout the entirety of the project timeline. We had a couple of cases where new research was even published since we started. And then we also had project partners direct us to various resources. A major takeaway from this entire literature review process is that certainly more research is needed that explicitly examines best practices associated with safety and risk assessments in the child welfare context. So the articles that we did find and that were selected served as the foundation for the creation of our data collection materials and then also our data analysis later. All of these resulting publications are included as citations in our final report as well. Moving us over to the next part of our methodology was a review of Colorado's documents. So HB 24-1046 specifically calls for this audit to, quote unquote, identify tools and resources to ensure the assessment is carried out consistently. So to comply with this directive, ICF developed a comprehensive document request that outlined the types of materials relevant to the audit listed here. We used a systematic approach, the ICF team, to review these documents relevant to the audit by creating a document review rubric. As I mentioned, this was developed based on this initial national best practice research and then also from input from the work groups, and then applied to materials that were submitted by the state representatives. We've got more information about that in one of the appendices of our report. This rubric examined key criteria related to tool design and guidance, which included clarity of definitions, use of plain language, completion requirements, and consideration of caregiver and child factors, among others. The rubric also assessed training-related criteria, such as the availability of interactive learning opportunities and attention to bias and cultural responsiveness. It also took into account risk assessment criteria, including definitions of risk, use of prior abuse and neglect, and then differentiation between abuse and neglect scoring, among other things as well. Shifting us over to talk about focus groups and interviews. So in addition to these research reviews and document reviews, we wanted to collect more in-depth perspectives from various project partners not already affiliated with the project work groups. So to do this, the ICF team conducted 6 focus groups and 2 stakeholder interviews. We used Microsoft Teams to have these conversations virtually, and you can see on the slide the list of the groups that we spoke with. We gained participant consent and recording of the transcription and then stored these recordings internally. We made sure to not have any identifying information or linking anyone to any specific comments. To analyze these findings using the transcripts, the ICF team employed a thematic coding approach using all of the qualitative data. So to do this, we developed a code book that aligned with the bill requirements to map conversations to key items. This analysis also included open coding, which means coders examined the transcripts to identify and label emerging concepts without limiting it to an imposed preconceived categories. This allowed the team to remain grounded in the data and responsive to unanticipated themes. We did this through a qualitative data analysis coding software called Deduce. All right, and then another data collection method that we used on the next slide to capture a very wide range of perspectives, again, to capture as many perspectives as possible. We also developed 3 tailored surveys targeting county workforce, legal professionals, and individuals with lived experience. Each of these surveys were customized to its audience, and questions were organized according to the audit items outlined in the legislation. These questions combined Likert scale items with open-ended responses to capture both quantitative and qualitative insights. And the workforce survey included an additional component to assess interrelator reliability, which was asking respondents to review hypothetical scenarios and determine whether imminent danger was present or not. Prior to distributing the surveys, these scenarios were discussed with our workforce work group, which we really appreciated, and then also had the lived experience work group members reviewing the survey to ensure cultural relevance and accessibility. And then once the survey closed, our responses were exported from Qualtrics, which is the platform that we used to administer the survey, cleaned and imported into our statistical software, SPSS, for the quantitative analysis. Additionally, a qualitative analysis of the open text survey items was conducted to identify themes. All right, and on that, I will pass it to Donna to discuss the rest of the method process. And Donna, if I pass it over to you, I think you might still be muted.
Yeah.
Ta-da. Okay, so as an in-depth complement to all the methods that Anna just described, expansive data sources, the case review process was designed to evaluate how the tools are applied and documented. So the goal was to assess alignment with policy, consistency in application, variation in risk and safety determinations, using a sample representative of the larger population within the time and budget constraints of the audit. The ICF team worked with DCF to implement a stratified sampling approach based on known variance factors like location, race, ethnicity. The sampling included cases of families that have been involved with the Child Welfare Agency. Unlike standard CFSR reviews that have at least 65 cases and they're designed to meet a very broad systemic assessment, this approach emphasized intensive fidelity testing over sample size. It was a small sample, but this method enabled the team to triangulate case file data with other data sources and stakeholder input to evaluate the application of the tools, providing a more comprehensive and detailed view of geographic, racial, case type variations, and larger reviews typically would allow. For example, on the assessment, the first page, there's a checkbox that says, was this completed with the family? And all of the assessments checked yes. However, when we look deeper into the case notes and logs, it was very difficult to tell whether it had been completed with the family during their visits, or particularly the first visit before the assessment was completed. We've added some, I added some results here. So just as a extra example, there are 32% of the 32% of the focus group and workforce survey people said they do complete them in real time, and that they think only 28% of staff complete them in real time. So this was an interesting sort of triangulation to look at the survey data and what the workers were saying, and also say, well, this is not being done in real time in the case review files. Okay, next slide. So this is a summary of the overall analysis approach, and it summarizes the different data sources that we have here and the systematic process that we followed. Unlike, we have the surveys and interview work groups, we have the review of the Colorado documents, case reviews, and the best practice literature. Each sort of, the arrows are only going toward the findings, but they each informed each other. And as Anna described, we used thematic coding methods and identified overarching themes and addressed all of the required legislative directives. So at this point, we finished the methodology discussion, and we'd like to give the group an opportunity to ask questions about the methodology before we go into findings.
And Donna and team, I don't see any questions that came through in the chat. So just a reminder to folks, as you're hearing from the team, please feel free to throw in questions or comments, and we'll pause throughout to get to those. But I don't see anything yet, Donna.
Okay. If anyone wants to come off mute with a question that's specific to the methodology or the other slides that we've discussed, feel free at this point. Okay, I'm going to toss the baton to Anna, who's going to give some context.
All right. Thank you so much, Donna, for passing it back to me. So I'm going to get our conversation about findings started. So first, this is just a high-level contextual context setting slide. Again, the slide that Donna just reviewed, we want to emphasize that throughout this audit, our process was designed to provide a 360-degree review of the safety and risk assessment tools in Colorado using a number of data sources. Before we dive into specific findings and recommendations that synthesize all those data sources, we want to first reflect our understanding of the overall strengths of Colorado's system and some contextual factors. So first, in terms of strengths, we can definitely tell that staff and partners of the project across Colorado are dedicated, very dedicated to these assessments and getting good results, and just committed to getting it right. We're also seeing across data sources that the tools are aligned with Colorado policy on paper. We also note that there are clearly defined safety thresholds and safety criteria. We also found that new worker training incorporates opportunities to practice using the tool, and training opportunities exist, and that caseworkers demonstrate strong agreement on clear safety threats. So things like injury, substance use, or sexual abuse that warrant removal decisions, there's agreement on. Lastly, Colorado benefits from overall a committed workforce that's capable of driving meaningful improvements through targeted reforms, and we note that across all data sources. Some of the contextual factors on the right-hand side of the slide We note that Colorado is currently experiencing organizational restructuring. We also note that funding and budgetary conversations and constraints are occurring that impact staff and community organizations at all levels of the child welfare infrastructure. And then lastly, that the structure of the child welfare system as state-run and county administered introduces variability in local implementation and also flexibility to address local needs. So in a moment, I will shift us over to findings by legislative directive. So we'll have one slide per directive, and that's how we've organized our results. These findings are summarized and represent our synthesis of all data sources, like we've mentioned, literature and document reviews, case reviews, work groups, conversations and focus groups, as well as surveys. So we'll mention that triangulation of all of those sort of 360-degree review data sources a lot throughout this presentation and any questions we discuss. We also will highlight some survey findings and quotes throughout our findings, but also want to remind folks that no data point is presented as a complete standalone in our report, nor do we want to represent things as total standalone. We, like Donna gave the example of something that was found in the case reviews that was also corroborated by something in the survey. So we try to do that where we can. So want to encourage us all to take the information holistically. So with that, I will have us look at the first directive on the next slide. All right. Thank you. So the first directive was identifying tools and resources to ensure risk and safety assessments are carried out consistently. So like I mentioned on the last slide about strengths, a major finding of this audit is that tools are well aligned with policy standards. They do contain guidance and instructions for assessing safety, danger, and risk. And across data sources, we found that though these guidance documents and instructions exist, conceptual clarity for tool constructs remains unclear. Some examples of this include definitions around primary and secondary caregivers, conceptualizations of vulnerability, and caregiver functioning. Additionally, specific to the risk assessment, there is an over-reliance on historical factors. So together, this inconsistent conceptual clarity, imprecise definitions, and risk assessment challenges introduce possible biases and inconsistency in documentation. The subjectivity was also noted across our data sources through commentary around the tools not fully supporting complex family situations like domestic violence or cultural considerations. So to illustrate some recommendations around some of these findings we had, first, we recommend redefining safety and risk using observable and behavior-based criteria to reduce subjectivity. So really getting clear on those definitions in guidance and training and practice and implementation. We also recommend revising or replacing the risk assessment tool and emphasize reducing reliance on historical factors to reduce biases. We recommend strengthening fidelity monitoring statewide and then aligning policies with ethical and equity standards to minimize unintended harm across the board. And the bottom corner of the slide is an example of some of the survey stats we've included. And so you can see in our workforce survey, there were 48% of respondents that agreed tools are applied uniformly. So more than half agreed they were not. And then the legal survey, 66% of respondents disagreed the tools are applied uniformly. So that's just kind of a tidbit. Again, we want to look at all of that in the context of the rest of the findings as well. Shifting us over to Directive 2. This directive was identifying gaps in solutions to enable caseworkers to complete the risk assessment in real time while in the field. So findings from multiple data sources indicate significant challenges in completing safety assessment tools and risk assessment tools in real time with families. These findings suggested that technological limitations, time constraints, and tool complexity being primary barriers to real-time assessment completion, with documentation inconsistencies further complicating verification of family involvement. So that family engagement piece also was noted across data sources as a real sort of factor in the nature these assessments are organically completed in real time and live with families. Instructions require assessments to be completed with families, but lack guidance on documenting this or explaining the results in real time as well. And then, like Donna mentioned, in the case review findings, completed family safety assessment tools sometimes indicated family participations, and then family risk assessment tools rarely did in real time. Some recommendations related to this, strengthening real-time documentation capability via mobile and offline tools, and then also really want to emphasize the ways a simplified design could help with real-time completion. And then also want to recommend improving documentation of family involvement with explicit fields for more narrative-based data and sort of open-ended fields throughout both of the tools to capture more nuanced information apart from just checkboxes. And highlighting here on the workforce survey, 32% of respondents reported being able to complete the assessment tools in real time during field visits. Okay, and then moving us on to Directive 3, this was examining the impacts of geography when using risk and safety assessments. We found that there was significant geographic variability in the implementation of both of the tools across counties, which is driven by differences in infrastructure, policies, and available services. So a quote that I wanted to highlight that isn't depicted here on the slide, but I'll just read out loud about just speaking to the different county to county resources. One respondent said, a safety assessment in a metro area that has 300 Medicaid providers is going to look very different than the community that has 4 Medicaid providers and 1 nonprofit. You can also see here across all 3 surveys, there was reflection on the differing consistency level across counties. Recommendations related to geographic implementation include investing in technology access like mobile devices, connectivity to enable real-time documentation and reduce disparities in sort of technology access. Also creating shared service models for supervision and consultation that provides surge support for small or less resourced counties. And then also addressing service availability gaps by partnering to expand healthcare, behavioral health, and housing supports, and adjusting the tool guidance around resource-related aspects where resource scarcity persists. So really speaking to some of those higher level systemic factors that partner with other agencies outside of the child welfare system. And with that, I will pass it back over to Donna to review the rest of the findings.
Thank you, Anna. So on Directive 4 is about examining the impacts of race and ethnicity when using the risk or safety assessments and how they affect communities that are overrepresented in the child welfare system. So when we examined the race and ethnicity considerations, we saw significant gaps in cultural responsiveness and equity. The document review showed that race and ethnicity are not inconsistently documented in the assessment tools, limiting analysis of the disproportionality. Some case notes observed in the reviews included subjective language without context, so it's difficult to decipher the race and ethnicity of the caregivers or the children and youth. Further, reliance on economic factors as part of the family risk assessment reinforces the conflation of poverty and neglect in child welfare, which can overall raise scores and decisions and impact decisions. Communication with families is often unclear and culturally misaligned, reducing trust and engagement with families. So recommendations that we have are to standardize culturally responsive documentation that ensures the family histories, strengths, and cultural identities are captured accurately and respectfully. Redesign the tools to reduce embedded bias by limiting reliance on outdated or disproportionate records. Integrate and strengthen the family diversity and bias mitigation training. And adopt engagement methods that center family voice and agency. And then in the bottom right, you see some examples of some of the survey responses that we got. Only 27% of the lived experience respondents believed the process honored their cultural history, race, and ethnicity. Only 27%, 14% of the legal survey have confidence in consistent application across racial and ethnic groups. On the workforce survey, 10% viewed race and ethnicity as barriers to implementation, but 41% doubted that their work in that would lead to equitable outcomes in assessment. Okay, Directive 5, please. So this one is evaluating and recommending best practices for sharing the safety and risk assessment results with families, legal professionals, and the judicial branch. So obviously clear communication of safety and risk assessment findings to families and child welfare partners is essential for transparency and informed decision-making. However, families and legal professionals rarely receive the assessment results in a timely, clear, or understandable way, creating widespread transparency issues and undermining the trust in the child welfare process. The results revealed inconsistent practices across counties and the need for culturally responsive, plain language communication. The assessment results are inconsistently shared with families and often lack clarity, cultural sensitivity, or literacy appropriate communication. Often, they're not shared with legal professionals until the judicial discovery process. So what we recommend is that there's standardized statewide assessment sharing protocols for families and legal partners. That you require timely and plain language sharing of results directly with families. Strengthen the training and coaching for caseworkers in communication and cultural responsiveness, and promote transparent, family-centered communication practices. So just as some examples of the results we got on the survey, the lived experience respondents, only 13% felt the safety and risk assessment process was clearly explained to them. And on the legal professional survey, 76% felt results are not shared in ways that respect the cultural and literacy needs of the families. Again, these are just a sampling of some of the results. There are much more extensive results in the body of the report and in the appendices, where every question and percentages are provided for you. Directive 6 was evaluating and recommending best practices for training on risk and safety assessments. So training on the assessment tools exists as part of an extensive 109.5-hour foundational training for new caseworkers, and they complete that in a 3-day safety through engagement seminar. The course description notes that the tools will be incorporated in learning through facilitation of assessment using the tools. On a positive note, 91% of staff received the CWTS training. Our findings also indicated that the training for new staff is heavily front-loaded, theoretical, inconsistent across counties, and insufficiently practice-oriented. Caseworkers reported feeling overwhelmed and need more applied learning, coaching, and cultural humility training. Across all the data sources, stakeholders consistently identified gaps in training and the application of training related to the assessment tools. Overall, while the formal training exists through CWTS and the county-specific programs, its effectiveness was limited by timing, varied content, and instructional planning and delivery. So what we recommend is expanding the application-based real-world training, mandating training on cultural humility. Cultural humility training exists, but it's not mandated. Mandating that for bias mitigation and trauma-informed skills, and optimizing the timing and sequencing of training to align better with worker field exposure. So in other words, workers are receiving information as they have more field experience and can understand better how to implement, and also include boosters and refreshers. So as I said, it's positive how many received the training. Only 43% though had training on addressing racial and cultural considerations. So we see how that relates to the other findings that we've discussed. Again, almost 2/3 felt prepared to use the tools of the workforce, and 69% felt confident applying the tools. Okay. Directive 7. Examining the risk and safety assessments for domestic violence or intimate partner violence and recommend best practices. So the current assessment tool, risk assessment tool, includes 2 domestic violence related questions with clarifications provided in the instructions, but not on the tool itself. What we found is that the language could be punitive or victim blaming, and domestic violence history is inconsistently defined. So it was unclear how the tool drives decisions around these issues. Concerns centered on victim blaming language and a lack of nuance around coercive control. Collectively, the findings revealed systemic gaps in language, guidance, and application, emphasizing the need for trauma-informed, culturally responsive, and pattern-based approaches to DV-IPV assessment within the Colorado's child welfare system. The lived experience work group flagged phrases such as caregiver engages in domestic violence or parent is unwilling to protect. Flag those as victim blaming language. So those are some examples of the phrases that fail to capture the complexity of coercive control, which can occur over a long period of time. Their suggestions included revising the DV IPV related items and using neutral, accessible language, removing punitive phrases, and incorporating transparency. What we recommend is enhancing the DV IPV items and removing the victim blaming language, expanding training on coercive control, trauma responses, and culturally responsive assessment, and standardizing the process across counties and unifying definitions and practices across community partners, so you're all speaking the same language. Just as some examples of findings, 57% of parents reported experiencing domestic violence or intimate partner violence during their child welfare involvement. However, 100% of them disagreed that their family was adequately assessed for those issues. Directive 8, audit the inter-rater reliability of the safety assessment. So we assessed this by using 5 case scenarios that were incorporated into the workforce survey. Only the workforce filled this out. So participants were presented with hypothetical scenarios, 1 to 2 paragraphs each, and they were asked to determine whether impending danger was present. The inter-rater reliability was evaluated in this way due to inherent challenges of trying to do it in a real-world situation. So the percent of agreement for the correct answer of whether impending danger was present or not for each of those scenarios ranged from 59 to 94%. So it's a pretty wide range. However, what we found is that the discrepancy or the difference in inter-rater reliability seemed to focus on identifying neglect. So highlighting persistent subjectivity in how workers assess impending danger, particularly involving neglect, which is unmet basic needs, hazardous living conditions, and suggest inconsistent interpretation of key safety concepts. So what we recommend is strengthen guidance on assessing neglect and poverty-related risks, expand training focused on impending danger criteria using high-quality case examples, and use more robust training cases for future inter-rater reliability checks. Okay, and our final Directive 9, audit the required documentation for the planning and removal of a child from the child's primary caregiver. Overall, the findings show that the assessment tools are intended to guide consistent and objective decision-making. We found they sometimes often fall short, due to subjective terminology, a limited ability to capture family nuance, documentation challenges, and inconsistent family engagement. Across the various data sources, participants expressed concern that assessment tools alone do not provide a full or reliable picture for determining child safety, which highlights the need for clearer guidance, stronger engagement practices, and a more comprehensive documentation to support transparent and accurate removal decisions. I'm going to refer back to the case reviews, and they provided insights into how the decision-making occurs in a variety of case types. We had 6 cases with an initial determination of current and impending danger, and the determination was that the child remained in home with a safety plan. The documentation on these cases provided thorough explanations of the threats. 5 of the cases had out-of-home placements based on the determination of current or impending danger. And contact logs for these cases provided considerable documentation of efforts to protect the child through an out-of-home placement, place the child with kin, and in 2 cases, reunification was achieved. However, lived experience survey respondents generally felt uninformed about the assessment and the decision-making process, and only 7% felt that the decision process was fair and consistent. What we recommend is enhancing the narrative and contextual documentation to capture the nuances of family circumstances, promote supervisory oversight and case review routines, increase transparency and accountability in removal decisions by establishing clearer expectations for rationale, ensure that families and legal partners understand the basis for decisions, and upgrade technology and documentation supports to allow that to happen. Just want to point out, we have some findings there in the bottom left of the slide. I already told you about the 7% of the lived experience respondents. On the legal survey, only 22% believe criteria within the tools clearly differentiates when removal is warranted versus in-home interventions may be more appropriate. On the workforce survey, in contrast, 64% report they consistently use the tools as the primary basis for child removal. So we had different results from different respondent groups. And finally, we have some overall recommendations. So we've generated a multitude of findings and accompanying recommendations, and it's very lengthy in the report. Each audit piece, each audit directive has a list of recommendations and findings in it for more detail. We've tried to consolidate the key themes and recommendations here on this particular slide, and these improvements include tool clarity and reliability, and also requiring enhanced training with practical case-based learning. Improve consistency and real-time completion. There's a need to expand mobile and offline technology access. A need to improve consistency across geographic regions, also due to differences in population needs and available resources. So you could consider, as we mentioned earlier, shared services or surge staffing for smaller counties. Tools training and resources to effectively implement the assessment tools ultimately would have the greatest impact on families. It's critical to ensure the tools are culturally responsive, and we recommend standardizing data on race, ethnicity, and expanding training on cultural humility and how to mitigate personal bias. The state has acknowledged the need for more effectively addressing DV/IPV issues, and this rang true in our findings. We recommend adding indicators of coercive control, removing victim-blaming language, and standardizing the language of DV/IPV statewide so all agencies and partners have aligned definitions. Finally, decision-making, such as child removal versus in-home safety planning, needs to be clearly and consistently communicated to families and legal professionals in a timely and culturally sensitive manner. And that concludes our presentation. We will now take questions. Thank you all for your attention.
Great. Thank you so much for that thorough overview. And team, we do have a question that came through in chat.
Yeah.
This is from Melanie, who is with ORPC. One of the strengths that you indicated was that there is alignment between Colorado policy and these assessment tools. So Melanie's curious whether that includes alignment between the children's code and the tools. Because one source of confusion has been that the tools aren't referenced in statute, they're only in rule. And so curious whether the strengths that you all noted primarily related to rule and or also included statute.
Great. Thanks, Yumiko. Certainly, I think Anna and Donna, Maddie, please chime in also. Our finding was really primarily related to rule. So what was seen and what we see documented in Volume 7 versus statute was really more that alignment.
Agreed.
Now, you're welcome to come off mute if you have follow-up questions or anything additional.
No, thank you. That answered it. I appreciate it.
Great. We have another 40 minutes. We've intentionally designed these sessions so that they're here so you can engage with this team, ask questions. We're happy to stay online. So yeah, really would love to hear your questions and thoughts. Melanie, please go ahead.
My question is more for the CPO. I think there are a lot of recommendations here and they're all really great. I feel a little overwhelmed, not even as a county partner, about how we would go about doing all of this. And so I just am wondering if the CPO has thoughts or if ICF has thoughts about what are the next steps from here. Just curious about that.
Yeah, Stephanie. I'm happy to jump into that one if that's okay. Yeah. Thanks for the question, Melanie. I really appreciate it because we certainly view this, not as an endpoint to the project, but to a starting point. So our focus right now for the month of March really is to ensure that our community partners, those who have participated and may find interest in this product, are able to engage with the ICF team. We're creating those open spaces where we can ask questions, where we can noodle with the findings and results and make sure that everyone is feeling comfortable in that understanding. And then from there, at the CPO, we are working to find ways to pick up this report and pull together some community partner discussions this summer. We want to go through these discussions so that we understand what the questions are, where we feel our community partners are. But after March, once we're able to kind of reflect on these meetings, we will be communicating to the listserv who received this report directly on Monday about bringing everyone together and discussing what are the implementation steps, where can we focus, whether that be legislation-based, whether that be working very closely with our partners at DCW. We want to use this information to help guide those discussions later on, because I agree with you, there's a lot here, and we want to prioritize as a community and as a group on how we move forward.
And I'll just jump in, Mel. Everything that Jordan said, and I know how thoughtful you are. And so I would just encourage you, as well as other people on this call and beyond, send us your thoughts in writing as well. Right? Because while we can certainly take comments from these sessions, I also know that some of the most important information we've ever received is from all of you, frankly, when you've had the time to just sort of sit and digest and process and talk to your staff and come back. So I would encourage sort of a written input process. And then again, just know that our team is going to get back with everybody. We're going to give everybody a break for legislative session and get through that with the goal then probably at the beginning of the new fiscal year to get moving. So, Jordan, maybe we can send that note out as well with future correspondence, like please send us written comments as well, because it can help jumpstart the process, right? Do we need 18 meetings? Do we need 10, right? All of those issues would help us.
And if you're interested in those discussions, again, please throw your email in the chat so I can add you to the listserv. We're building that as we go. So absolutely agree. We'll be seeking written feedback here shortly.
Yeah. You're a thoughtful bunch. We know you.
I know. Very quiet.
Everybody on this phone call is super smart and thoughtful. So yes, I'd be excited to know more deeply about what you're all thinking.
I thought hi, Kara Nord from the Office of the Child's Representative. I thought your comments and suggestions related to historical data, are important, and particularly important when it comes to the disproportionality, that's so prevalent in our system. And I always think the historical data question is so difficult because, first of all, do we take it into consideration? Whether it's in the courtroom or in a safety assessment, right? Do we take it into consideration? And if so, how do we take it in consideration and how much weight do we give it, right? Should there be a time limit on it? Should it be within this child's life? Should it be within the last X years? I always think the historical data is just such a quagmire. So I don't know. I'd be interested in hearing maybe some of ICF's thoughts about a little bit more of your thoughts, if you'd be interested in sharing some more of your thoughts about the historical data.
I can start us off with that one. That is a great question, and I think you bring up a great point of it is so complicated. So there probably won't be a one size fits all for it. I think one thing that consistently came up in the lived experience work group was this idea of leading with curiosity rather than judgment. That historical piece can add such a big piece of judgment and contribute so much in these assessments. So how do we look at the whole thing and not just one aspect of it, I think is really important. But like you said, that's not really a complete answer. Does anyone else have any suggestions or anything to add?
I think that's definitely spot on, Maddie. And also, yeah, I don't have a one size fits all answer either. I think the recommendation, at least across data sources that I observed, is like decreasing the reliance on it, right? Like we don't want to exclusively look at historical data. We don't want to completely discount it, but I think the recommendation we have on the slide that you're referencing is, yeah, just decrease the overemphasis on it, if that makes sense. And definitely curious if Anne or Donna have anything else to add.
Thanks, Anna. I would add, I think, the caution around relying on that historical data a bit too much, in that we know that much of that historical data is based in disproportionality, and how that can impact families moving forward. So certainly another consideration also.
I just want to make the connection from and from what you just said to popular predictive analytics, and it's being experimented with, researched around the country and used in some counties, or experimenting with it. So that that historical piece plays very heavily into predictive analytics because it's built into the algorithms, and so it's sort of implicit bias there. I just want to make that connection, and we don't have an opinion about predictive validity, whether you should use it or not use it. It's up to you, but just that part about historical bias is somewhat related.
Right, in the courtroom, we call it action and conformity therewith. Right, it's an objection. Right, yeah. Mm-hmm.
I just wanted to add in a comment from Mick in the chat along these lines, that history can also be helpful in being trauma informed when working with a family. I'm assuming, Mick, right, not having to have families re-explain, revisit, reopen past experiences all the time. So thanks for that.
All right, well, everyone else is thinking of some questions to engage. I am going to put my email directly in here. I have received all of the emails for the listserv, and we'll be sure to add them. I'm going to drop my direct email in here. I'll be the one receiving and I hope you do send your written feedback regarding the report that we can integrate here as well. Other questions or responses?
I have a question. I joined a little late, sorry, but I was wondering, how many Native parents did you have in your group for the parents with lived experience? I'm an enrolled tribal member and I work with a lot of ICWA cases, and a former permanency caseworker, so I'm familiar with the tool. I honestly think they should only be completed by a supervisor with their worker, and hand in hand to create that accountability. But did you have any Native parents, especially now that we have the new Colorado ICWA law? I really advocate for holding the department accountable to preventing the removal as it is required under active efforts. And also in the tool, they don't have any specifics from what I remember when I did these assessments, anything specific to ICWA. And if you need some Native parents, I can help connect you with some.
Thank you, Elaine. We did on the work group. I don't know about the survey just because I don't have that data up right now. And then just for like de-identifying purposes, I can't share how many, but we did have Native representation there. And thank you for uplifting that.
Good to know.
And Elaine, I'm going to be a pain and ask if you wouldn't mind adding your email into the chat so I can keep you on the listserv and we can follow up on some of those points.
I did. It just has it under my maiden.
Thank you.
Thank you.
And I believe, Maddie, in the written report, there is much more information that breaks down, as much as you were able, demographics, information from the surveys, work group members, etc.
Yeah, I always just try to be as careful as possible
For
with that
sure.
stuff. Yeah, if it's
Yeah.
in the report, of course.
I have another question. In the report, also, and today you summarized involvement from the family in completing the assessments. Did you get into it all? I, of course, hope and assume that by family you include the young people, the children in the family. Did you get into it all at what age you would recommend the involvement of the young people, or consideration of their developmental level, et cetera?
I think, again, another great question. With a researcher background, my recommendation is always it's great to do more research on these things and figure that piece out. I don't think we have an exact age for a recommendation. Knowing what I know, and I'm sure it's different for Colorado, but nationally, it seems like there's a big push for age 12 and above to be really involved. But again, we didn't really get into that in this report.
Thanks, Maddie. And knowing 12 and above is not going to be a blanket, applicable to all families based on each family's unique composition and experience for sure.
Here, I'll definitely make a note of that question and work it into some of the agendas we prepare for this summer as well.
Or CR would like a consideration of every young person, consideration of their developmental level, regardless of their age. You can have a very precocious 5-year-old who has a lot to say and is very aware of what's going on in their family.
Melanie, please go ahead.
One of the recommendations I really appreciated and don't think we talk about enough in this system is the one around domestic violence and the stigmatization of victim survivors of domestic violence. And I just am wondering if there are any best practices that you would lift up from other states around that, or I just am really curious how to make progress on that one, and know that there are currently work groups at our NCDHS that are addressing some of these issues, and just am trying to maybe integrate some of your findings with the work that is being done there.
Thanks, Melanie. Certainly, I think there's a continued conversation between advocates for domestic violence, intimate partner violence, and child welfare, and the intersection of that. Certainly, I think there was definitely conversation. Maddie can share a little more around the work groups, though it was certainly a continued conversation.
Yeah, thinking back to the work group discussions, and I think I highlighted this a little earlier, one thing that consistently came up with leading with curiosity instead of judgment, trying to understand and bring that compassion to maybe why people are staying in these situations, why they have to. Another one that also is in our recommendations is, I believe on our slides, it was expanding training for coerced control or other forms of abuse that may not be as obvious or we might not know to look out for. And then our other recommendation, of course, is just around the language, removing the victim blaming language, and other things like that. I don't have any national resources off the top of my head, but I'm sure there are states and local counties doing great work.
Really, really wonderful follow-up questions for a number of reasons. So I appreciate the deep engagement and what has clearly been a very deep, thorough read of a very long report. So thank you all for coming so prepared. as people kind of generate their next questions, I just wanted to share what these information sessions are going to look like throughout the month. You will see the same presentation from ICF with the intention of giving everyone multiple access points to come to these meetings. You'll see that we tried to stagger them in time of day, the day that we chose. So we're hoping that we see more people come. But really would encourage everyone here who's interested in the topic to come to these sessions, because these kind of after discussions where we're discussing points of the report and themes that we could carry forward will all be different. We're recording all of these conversations. They will go up on our website, so you can track them that way as well. But I would just encourage, if you're available, we would love your continued participation in these discussions. Even if you want to join maybe a little bit later, that's okay too. But it's these things that we're really going to use to help shape those engagements and discussions we're going to have this summer. Any other questions, comments, feedback we want to bring into the space? Miko or the ICF team, anything that we want to kind of elevate, uplift?
I would lift Maddie's note here that we really appreciate the questions. They're great questions so far. Thank you. It is clear you've folks have dove into the report.
The only other thing I would say from my role as a liaison, I've never worked on a project where it was so easy to get people to engage, to be part of focus groups, to fill out surveys. If you look at the data in the report, just some of the response rates and folks who enthusiastically participated was really amazing. I think Anne had it in some of her opening slides as one of the big strengths is that it was very clear that partners across the system are really interested in this topic, know that how important it is to get it right. And so I have no doubt that these ongoing conversations will be very interesting as well, and you'll get lots of participation.
Yeah, as I said in the chat, Yumiko, thank you for raising that, because we were really impressed with how willing people were to join the groups, to fill out surveys, to answer questions, and really be honest and open and forthcoming. So it was really impressive.
Yeah, and just want to name that a number of people on this call were a big part of that. So thank you, to our partner agencies who are on this call who helped make those connection points and help make their teams available to engage. We know this was time intensive for a couple of you, so thank you. Okay, well, I am happy to stay online. I will not force others to sit in Zoom silence, but again, really want to thank all of you for coming and giving us part of your day, and really want to encourage you to come to our next session, which again will involve the same presentation, but we'll have ongoing discussions similar to this. The next presentation or information session is going to be on March 10th. We're going to go in the morning from 10 to 11:30. And again, all of this will be recorded, it will be posted online, but really would encourage, please let your colleagues know that these are going on, let them know we're having discussions, and that this is really, again, the kickoff point to this next phase of this project. So we continue to be excited to engage with all of you, and huge thank you to the ICF team for all the work that they put into this presentation and the report as well.
Great. Thank you, Jordan. Thank you all. Appreciate your time today.
Thank you again.
Thanks, everybody. Good to see you all. Thank you.